This video reported an effective assisted method using simple retrieval bag in laparoscopic myomectomy by Professor Yang's group. Laparoscopic surgery with a tiny keyhole-like incision on abdominal wall so as to avoid abdominal trauma and rapid recovery has been widely applied to gynecology, general surgery, urology, and other fields. Currently, vast majority of the traditional open operation has been replaced by laparoscopic surgery. Laparoscopic resection of myomas is no longer difficult, but how to safely, minimally invasively, and conveniently take the enlarged myoma out from the tiny incision has become an international problem. Among most approaches, myoma's morcellation inside an enclosed space has been advocated in various forms of minimally invasive myomectomy to minimize the potential risk. In this study, a simple self-made retrieval bag was used to contain tissue extraction and thereafter prevent the occurrence of above complications. The patient reported in this video is a 32-year-old young woman diagnosed with a 6 cm uterine myoma through ultrasound and MRI. She suffered intermittent lower abdominal pain for 4 years and infertility for 2 years. Before the operation, a retrieval bag was self-made using a sterile medical bag in advance. Furthermore, silk thread and suture instruments are needed for this retrieval bag. Check the medical bag and make sure there was no damage. Fold the bag mouth into 2 layers and sew down along the fold of bag mouth using silk thread. The retrieval bag was the sterile inner package to contain disposable surgical supplies. The material for the medical bag is medical thermoplastic polyurethane, which is usually used to construct extraction bag, not the silk thread. The retrieval bag was ready for use in laparoscopic morcellation to contain the tissue extraction. Inspecting the pelvic cavity was performed firstly. The location and number of myomas were evaluated and determined. The largest myoma was located in the right broad ligament. The anterior leaf of right broad ligament was incised. Gradually, the myoma was exposed. Myoma was resected. The uterine wound was sutured and closed. The myoma located in the posterior uterus wall was resected. The above-mentioned retrieval bag was put inside abdominal cavity. The myoma was collected into the bag. We tightened the bag and pulled the bag mouth out of the body, then filled carbon dioxide gas into the bag. Laparoscopic power morcellation was used to morcellate myomas into pieces inside the bag. After morcellating myoma, carbon dioxide gas inside the bag was excluded firstly, and the tiny myoma fragments together with the retrieval bag was taken out from abdominal cavity. Finally, the pelvic cavity was explored again and the surgery was finished. The myoma was successfully and completely extracted by laparoscopy using a self-made retrieval bag to contain tissue extraction. Operative time was 93 minutes. In the follow-up period, the patient did not report any symptom of iatrogenic parasitic myoma. The woman got pregnant at time of 26 months after operation and underwent a cesarean section at full term. The use of retrieval bag to contain tissue extraction during laparoscopic morcellation can avoid the risk of iatrogenic parasitic myoma. The retrieval bag is self-made using a sterile packing bag, which is cost-free and thereafter reduce operative expenses. That's all. Thank you.